Welcome back. This video will show you how to convert your 1Tickler to a progress note and then how to code and sign the note. So again, if you are someone who likes to create your notes beforehand, I do encourage you to use the 1Tickler like we talked about. And when it comes time to sign and code your note, it's actually pretty easy to do that. So um, some people make the mistake of actually copying and pasting and starting a new note. You actually don't have to do any of that. What you do is you come up here to the right-hand corner, click on the Change button. You can see that 1Tickler is highlighted. You go up here to Primary Care Progress Note, so that's highlighted. Another important thing is that you change the time and date of the note. So let's say I've started working on this note on August 3rd. Unless I click this button and click now, it's going to show the note is going to show up as August 3rd, and it's going to look like you saw the patient on a different day. So make sure that you click the date and time. You're going to click OK, and this is probably the most important thing here. You're going to get this question mark that pops up. Do you want to clear the previously loaded template? The answer is going to be no. If you click yes, you're going to lose your entire note. So it will become sort of second nature, but you're always going to click no. Okay, and then now you can see here that under the primary care progress note, um, it's been changed from a 1Tickler to a primary care progress note. All right, so now when it comes time for coding, I'm actually going to change this real quickly. So I'm going to set this up as if we had a real visit here. So I'm going to go to new note and I'll just type in this. Okay, so now I'm going to go to sign note now. I'm going to get this pop up that says missing encounter information. You're going to click OK. And this is the coding screen here. So let me walk you through this. So the parts that are important for you to fill out are the visit type or type of visit. So most of your patients are going to be established patients, but you may have some new patients. So that's an option, new patient, established patient. If it's a once a year preventive medicine visit, you can also click on that. It gives you the option of new and established patient. Let's say it's an established patient. Section name, this is basically coding 1 through 5, which I'm sure you're familiar with. Most of our visits I code as a 3, so I would click that. Um, here under the, so this is box is called service connection. So service connection is uh, something that many veterans have, and a service connection is a condition that uh, one of two things. It either is a condition that was simply documented while they were in the service. The examples would be, high blood pressure, sleep apnea. Basically, they had one of these issues. It was documented in their military medical record, and so they're have the ability to be compensated for that. The other type of service connection is a condition that resulted as from their military service. So, examples would be post-traumatic stress disorder, if they had a limb amputation, something like that. So, if they have a service connection, what it's going to ask you here is what this patient does not have a service connection, but this box will be yes or no. So, basically, is the visit related to their service-connected condition? So, if they were service-connected for, hypertensive heart disease and the visit was mainly related around hypertension, you would click yes. The reason that that matters is that it has an effect on co-payments. So if you click yes, it's related to their service connection, they will not have a co-payment for um, for the visit. So in this case, this patient there has a history of military sexual trauma, so we're going to click off no, that the visit is not related to that. The current providers here should be automatically defaulted. You should be listed as primary. And then you're going to click over here to diagnoses. And so these are items that are in their problem list that we talked about in a previous video. So let's say that the visit was mainly related to diabetes. You could click diabetes, and that would show up here as the primary diagnosis. Let's say we also did a touch on peripheral vascular disease. That was a secondary diagnosis. And we also talked about alcohol abuse. Let's say there's an item that's new that isn't in the problem list. Let's say, for instance, hypertension was not in here. You could click on other diagnoses, and manually enter it, click essential hypertension, and again, that would come down here into the diagnoses box. And that is basically it for coding. So then I'm going to click OK, and I'm going to enter my code, and that's pretty much it. So not too bad. So that is how we convert the 1Tickler to a primary care progress note and how we code our note.